Welcome to Ojo con su visión. We are running this program at the Primary Prevention Mobile Unit, University of Arizona, and the Mexican Coalition for the Empowerment of Youth and Families with the National Eye Institute. This video will go over how to protect your vision. You will learn about eye problems related to diabetes and the dilated eye exam. Let's start with the risk factors for getting diabetes. A risk factor is a characteristic like age, a condition like obesity, or things we do like eating too much. They can harm one's health or raise the chance of getting a disease. There are many major risk factors for getting diabetes. We cannot change some, like family history. You are more likely to get diabetes if any member of your immediate family has diabetes. This includes your father, mother, grandparents, brothers, sisters, and first cousins. We can change other risk factors with healthy habits, such as walking for 30 minutes every day. Some risk factors that we can change are 1. High blood pressure. For people with diabetes, blood pressure should be lower than 130 over 80 millimeters of mercury. 2. Obesity. People with obesity can eat less and exercise more. 3. High cholesterol and high triglycerides, which are the most common type of fat in the body. Blood tests can tell people if they have high cholesterol and high triglycerides. 4. Gestational diabetes. If a woman gets this while pregnant, she is at a higher risk for getting type 2 diabetes later. Let's talk about diabetes. It occurs when the body has too much glucose. Diabetes can cause problems such as heart disease, kidney failure, and amputations. A person with diabetes may get eye diseases. They include diabetic retinopathy, cataract, and glaucoma. A person with diabetic eye disease can have low vision for the rest of one's life. Even with glasses, contact lenses, medicine, or surgery, people with low vision struggle to do everyday tasks like reading the mail, shopping, cooking, watching TV, and writing. A person with diabetes is much more likely to become blind than a person without diabetes. However, a person can lower the risk of blindness. Later, we'll learn how. Let's talk about how you can reduce the risk of blindness through early detection and timely treatment. Some eye diseases do not have symptoms. Do not wait to get your eyes checked. See an eye doctor, called an ophthalmologist or optometrist, at least once a year. The eye doctor will conduct a comprehensive eye exam. This means the eye doctor will check your vision and look for problems such as nearsightedness, farsightedness, or astigmatism. The eye doctor also will perform a dilated eye exam. Only an ophthalmologist or optometrist can do this. The dilated eye exam is short, simple, and painless. The eye doctor will put 2 eye drops in each eye to open the pupil. This lets the eye doctor see more of the inside of your eyes. The eye doctor will check for problems with the lens, cornea, retina, and other parts of the eye. The earlier you know about eye diseases, the earlier you can get treatment. Now let's talk about the 3 diabetic eye diseases. The first one is diabetic retinopathy. It damages the small blood vessels in the retina. The longer someone has diabetes, the more likely he or she will get diabetic retinopathy. A person with diabetic retinopathy can have eye problems for different reasons, like bleeding, detachment of the retina, and abnormal blood vessels in the retina. There are often no symptoms in the early stages of diabetic retinopathy. There is no pain, and vision may not change until the disease becomes severe. Now, what does a person with advanced diabetic retinopathy see? This is what a person with normal vision would see. Compare it with what a person with advanced diabetic retinopathy may see. Treatment options include eye injections, laser surgery, or removal of the vitreous gel. The good news is that you can reduce the risk of blindness by 95% with early detection, timely treatment, and appropriate follow-up care. Another diabetic eye disease is cataract. It is the clouding of the lens in the eye that affects vision. Symptoms of cataract include cloudy and blurry vision, faded colors, poor night vision, double vision, and problems with bright lights, especially at night. What does a person with advanced cataract see? Compare what a person with normal vision would see and how a person with advanced cataract may see the same scene. Cataract can occur in one or both eyes, but it cannot spread from one eye to the other. In earlier stages, the cataract is not yet visible. You must get an eye exam to know if you have it. A person can improve symptoms of early cataract with new eyeglasses, brighter lighting, anti-glare sunglasses, or magnifying lenses. If this does not help, surgery is the only way to make things better. The third diabetic eye disease is glaucoma. It is a group of diseases that can damage the optic nerve and lead to vision loss and blindness. High eye pressure may cause glaucoma, yet in some forms of glaucoma, eye pressure is normal. A form of glaucoma called open-angle glaucoma happens most often to African Americans aged 40 years and older, everyone over the age of 60 years, especially Hispanics and Latinos, and people with a family history of glaucoma. People with diabetes have an increased risk for a severe type of glaucoma called neovascular glaucoma. In this form, abnormal blood vessels grow in the front part of the eye. People may not know they have glaucoma until the disease is advanced. In the early stages, it often has no symptoms. This is because if someone cannot see out of one eye, that person may use the other eye more. Now, compare how a person with normal vision would see and what a person with glaucoma may see. A person cannot regain vision lost to glaucoma. Yet once again, with early detection and treatment, a person can avoid or slow down vision loss. Treatment options for glaucoma include medications such as prescription eye drops, pills, or surgery. Last but not least, the eye health team. A person with diabetes can get help from a certified diabetes educator, health promoter, nurse, ophthalmologist, optometrist, pharmacist, primary care provider, and social worker. But a person with diabetes has the main responsibility to control his or her glucose levels and get a dilated eye exam at least once a year. Do not forget that people with diabetes can ask their primary care provider for ways to control their glucose levels, blood pressure, and cholesterol, can take action to protect their vision, and should visit an ophthalmologist or optometrist at least once a year. Don't forget that an annual visit to an eye doctor can help prevent blindness. Thank you for watching this video. Call your ophthalmologist or optometrist to schedule a dilated eye exam. Also, share this message with your family and friends.